Hey everyone, welcome to another edition of the Right Way Wednesday. Today I have Sarah Wendel with me, and she and I are going to talk about group and concurrent. I know that you have been hearing, regardless of who you are with, you have been hearing a lot about group and concurrent, adding that in because it is a really highly underutilized, both of them, treatment modes at the moment, and there are several reasons why that is. I think one big reason why group in particular is underutilized is really because of clinicians' comfort level with planning groups and then putting them all together and making them happen. And so we want to talk a little bit about that. So Sarah, you've been talking a lot about this as a clinical strategies team member. Let's talk about, I think, the most important part of group and concurrent modes of therapy. How does the patient benefit from these types of modes of therapy? Because there is a benefit, right?
Absolutely. I've actually done a pretty extensive literature review recently, and there have been quite a few documented benefits. The thing that excites me the most as a clinical strategies person is it actually demonstrates improved clinical outcomes. So when you're using group therapy as an adjunct to your individual therapy, we're seeing better gains. Other things that have been documented include good patient satisfaction and good buy-in to that process. So I know it's new for a lot of our clinicians. However, it's going to help. So that's really exciting.
Yeah, one of the things at Health for Heritage that we do is they have like a clinical sort of, a contest every month. And one of the things that I see when our teams submit entries is they're doing more groups and they're talking about how much their residents really actually enjoyed it. And some of them talk about how surprised they were about what the residents themselves got out of it and what they in their response to it. So yeah, it really can be great. So then thinking a little bit deeper into that, then how do we tie groups and concurrent treatment into outcomes? How do we use them to get better outcomes for our patients?
Great question. So we basically have to align any sort of group or concurrent treatment with what the individual goals are for our patients. So we have to be very thoughtful and purposeful about who we're putting in a group together, who we're putting in concurrent together, and really have some delineated goals and objectives before you even get started. So for instance, if you had 4 people who had cardiopulmonary conditions, that would be a great group to do a health literacy group and talk about things that they could do to prevent their risk of rehospitalization at home. But if you don't plan that ahead of time, you're really not going to get the sort of benefits that you could have from a very thoughtful, well-designed group. So it really takes the collaboration of the rehab director and the treating therapist to really think about who works well together and what is the purpose of the group. And that's where we're really going to see the best benefit.
Right. And I think it's worth saying that not every patient is going to be able to participate in a group for whatever reason. So yeah, that thoughtfulness about how you're grouping those patients is really important and who you're putting in there. All right. So let's talk about then the end piece of this. Once we've completed the group, for whether we are a physical therapist, an occupational therapist, or a speech therapist, how do we then bill for that? What are the guidelines around that?
So for a group, it's the time, you have to really keep track of your minutes. So the moment that all of your people have come together, that is the time that your group minutes start. And so you need to keep track of when that group ends as well. And those are all going to be billed under your specific group therapy code. Any sort of transportation time before that group starts would still be considered individual minutes. And then thinking about our documentation, we need to really be not only discussing what we did with the group, but how did that specific patient respond? What did they participate in? If it was an educational group, what sort of retention did they have? Do we have any quantifiable way to measure that? What sort of follow-up do they need after that? So really trying to get the essence of that group, what our intention was, and then how did that particular patient do? It needs to be documented. The notes should look different for every single person that participated in that group.
And we actually do have a tool for group and concurrent and documentation thereof. So we've got some great samples in that tool that we really just shared on the page, I think like 2 or 3 weeks ago. So you can go check that out too if you want some information about that too. All right. Thanks so much. We really appreciate it. So from Sarah, me, and Lucy over here, thank you for joining us for today's Right Way Wednesday. Thankfully, she's been nice and quiet for us because I forgot to put her away. But we appreciate you taking the time. Let us know if you have any questions in the comment boxes below. And happy documenting.